Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you today. American Academy of Dermatology releases guidelines for atopic dermatitis in adults. Atopic dermatitis is a very long-lasting allergic reaction that tends to flare up periodically. It may be accompanied by asthma or even hay fever. No cure has been found out for atopic dermatitis as such, whereas several studies have reported their comorbidities. Now, guidelines in the Journal of the American Academy of Dermatology enumerated clear evidence of the association of atopic dermatitis in adults and selective allergy, atopic immune-mediated mental health and bone health conditions, as well as skin infections was also identified. The guidelines mentioned that the clinicians should be aware of the comorbidities associated with atopic dermatitis. They also enlisted evidence of association with various cardiovascular conditions. However, the association between atopic dermatitis in adults and autism spectrum disorders, myocardial infarction, stroke, and metabolic syndrome, however, is still very inconclusive. Self-care behaviors with religious attitudes to be linked with anxiety and depression in patients with heart failure. Globally, it is estimated that 4.4% of the global population suffers from depressive disorder and 3.6% from anxiety. Now, heart failure is a condition commonly presented by shortness of breath, edema, fatigue, and is the most common cause of death globally. Heart failure, being one of the major concerns and problems associated with anxiety and depression, causes a change in the self-care behaviors. Now, a recent research in Research Square Journal revealed that self-care is directly related to anxiety and depression, and the effect of anxiety is much greater than depression. Therefore, according to the results of the study, it concluded that if one can reduce the anxiety and depression and the stress level of these patients with various methods, that can promote self-care and often improve their health status. Women with elderly obese partners at higher risk of embryo implantation failure. Fertility in humans usually declines with age. Older couples find it very hard to start a family. Some require medical support to conceive and successfully even carry a baby full term. A paper published in the journal Gynecology and Obstetrics Clinical Medicine, where it stated that a group of researchers explored the effects of advanced parental age and abnormal parental weight on in vitro fertilization treatment in couples, and said that the definition of recurring pregnancy loss varies by country and society. As such, however, it is not easy to predict with assisted reproductive technology which is the best option to achieve pregnancy. The identification of these potentially modifiable risk factors may prove useful for some patients. Starting physical activity 3 days after concussion, safe and has better outcomes. Concussion, as defined as a traumatic brain injury, affects the brain function, usually presents with headaches and dizziness and even vomiting. A recent research has suggested that resuming non-contact physical activity 72 hours after a concussion is considered safe and may also reduce the symptoms and the risk of delayed recovery. The study sets out guidelines for gradually introducing physical activity back into the daily routine of a child or a youth who've suffered concussion. If symptoms are tolerable, the youth should increase their physical activity intensity the very next day. If symptoms are not tolerable while doing physical activity or even after the activity, the next day the child or the youth should return to the last well-tolerated activity intensity and re-attempt progression after 24 hours. However, they must be cleared that their primary care provider before returning to contact sports. PPI oral glucocorticoids use linked to fracture risk in rheumatoid arthritis patients. Rheumatoid arthritis, as we all know it, is an autoimmune and an inflammatory condition where one's own immune system attacks the healthy cells in the body, causing inflammation in the affected parts. Now, these patients commonly use proton pump inhibitors or oral glucocorticoids in their prescriptions, both of which are associated with osteoporotic fractures. Now, concomitant use of proton pump inhibitors as well as this combination with oral glucocorticoids increases the risk of such fractures by 1.6-fold in such patients aged specifically 50 years and above. A recent study published in the BMJ journal Annals of the Rheumatic Diseases finds that fracture risk assessment should be considered when a rheumatoid arthritis patient is prescribed both oral glucocorticoids and proton pump inhibitors. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.